Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and I want to welcome and thank you all for coming out this afternoon. I know we've been in this long haul together, and we are so pleased to be announcing a large community-based vaccination site in addition to our mobile vaccination sites. This ADA accessible community site will be vaccinating community members in phases 1A and 1B, and of course our expansion in 1B beginning on February 25th. Our mobile sites will be focusing on our essential workplaces and congregate living this week. This has been a colossal collaborative effort, and our thanks go out to many of our partners. First of all, we'd like to thank the Governor of the State of Illinois, Governor Pritzker, leadership at the Illinois Department of Public Health, the Illinois Emergency Management Association, the National Guard, the County Emergency Operations Center, the City of Rockford Emergency Operations Center, the Winnebago County Board, our community partners, including our healthcare systems, the Winnebago County Medical Reserve Corps, local citizen volunteers, the vaccination planning team, Rockford Mass Transit District for their willingness to consider expansion of bus routes and transportation to this facility. And I would be remiss if I did not thank one of our local citizens who came forward to help us identify a location of space, Mr. Sunil Puri, and his team for making this possible through the donation of the space to host this location. If you didn't recognize it, it took an entire community to bring this to fruition, and that included our state partners as well. And so I'd like to have Mr. Puri come up to say a few words on behalf.
Good afternoon. I'm Sunil Puri with First Midwest Group, and we are pleased to essentially donate the space for a community-wide effort. What I have to emphasize is our company's investment in the community. We bought this building a year and a half ago, invested this money, so we were prepared, and Rockford just needs to be prepared, I believe, for opportunities like this when they come up. Besides the testing outside, we're happy to provide this location. I can't thank our staff, which is very busy in the wintertime, but Mike Capriola and Don Wood, who worked here tirelessly from Thursday. So I got a call Thursday morning. We said, we'll do it no matter what. This will transform our community with the number of vaccinations they could do. By Thursday afternoon, you had the keys. By Friday morning, the shortest lease we've ever done, since it was $1. By Friday morning, you had a lease. And by Friday afternoon, they were moving things here. That's what it took. And that's, again, like Dr. Martell said, when a community comes together. We had our people working here on the weekend. They drove as far away as Naperville to go get ceiling tiles to make sure everything was appropriate in this area. Wouldn't happen if it wasn't a community effort. Thank you again for the opportunity.
I think it's important to understand that our community will be vaccinating along with the Illinois National Guard based on the phase, which includes age, occupation, health conditions. I want to remind the public there are no walk-ins. This clinic is by appointment only at this time. I want to be clear that as we move through the phases, those conditions may change, but it's important for the community to understand that you just can't walk in here. Only those with an appointment for a vaccine will be allowed in the clinic area for safety and security. We ask that drivers and other family members or friends wait in their vehicles. And remember to practice social distancing and always wear your face covering when outside of your home. To get an appointment, we want to remind everyone to please register at www.wchd.org and wait for your appointment. We have pushed appointments already out to those who are eligible as part of Phase 1A this afternoon, so they are already getting an opportunity to schedule over the next 6 days here at this location. If you need help registering, please call the COVID hotline at 815-319-6705 We recognize, as we have from the beginning, that we have residents in our community that may need assist with computer technology, and we have a team there that's helping at this time. And again, I would want to thank also the city clerk of the City of Loves Park. They've been helping us as well to help register individuals that we identify through the call center. Please do not call to determine your place in line, as it is not a first-come, first-served clinic. We have a plan for zero waste, so hanging out outside the doors will not get us any closer to our goals. When we have vaccine allocations to cover the community-based and the mobile sites, we will allocate the healthcare systems to continue their vaccination efforts as well. We've had to do a little bit of a pause, as we know, about vaccine allocations, but through all our multiple partner efforts, the healthcare systems focusing on their over 65 enrolled populations, the community-based site for the community, as well as then our mobile sites focusing on the essential workplaces. All of us will be vaccinating throughout this time frame with the available as a team, as a one goal of vaccinating our entire community. So we thank everyone for their patience and understanding as we work through these vaccination efforts. We have you, and we will get you vaccinated if you want a vaccine. I will also give you your numbers for today. Our positivity rate is at 3.1%, and I know we've worked very hard. We've been in one of the regions in the longest area. Over the weekend, we saw 69 new cases, including today, which brings our total count up to 26,636. But unfortunately, we lost one more resident again, and our entire community mourns the loss of all of our residents who have died from COVID. And to date, we have vaccinated 39,027 vaccine doses, and 3.4% of our population has been fully vaccinated. We have no new locations of concern to report, and one of our locations that has had 2 incubation periods with no transmission, Cherryvale Place, is coming off the list of our locations of concern. So again, it's through the efforts of a community. It took an entire community and the willingness and generosity of spirit of individual citizens, of the support of our, what we call our citizen, soldiers to support us, as well as our contract staff, our public health nurses, our elected officials. It required an entire community. And with that,